The Equinus Brace is a 1 hour per day treatment for plantar fasciitis and equinus deformity. It telescopes above the knee to provide both a gastroc and a soleus stretch. The toe wedge engages the windlass mechanism and provides a plantar fascia stretch. By using hinges, the dorsiflexion can be measurably increased throughout the patient's treatment regimen. In this video, you will learn about coding, documentation, how to properly diagnose equinus, and billing. According to the local carrier's determination, or the LCD, the Equinus Brace is eligible for reimbursement if a patient is diagnosed with plantar fasciitis or ankle joint contracture. The ICD-10 codes are M72.2 for plantar fasciitis, M24.571 for right ankle joint contracture, and M24.572 for left ankle joint contracture. When using the ankle joint contracture diagnosis, the LCD states 4 requirements. Number 1, plantar flexion contracture of the ankle with dorsiflexion on passive range of motion testing of at least 10 degrees, i.e. a non-fixed contracture. This is from the patient's most plantar flexed position. Number 2, reasonable expectation of the ability to correct the contracture. Number 3, contracture is interfering or is expected to interfere significantly with the patient's functional abilities. Number 4, used as a component of a therapy program, which includes active stretching of the involved muscles and/or tendons. When evaluating a patient with an ankle joint contracture, it is important to document a few key measurements. Dr. Patrick DeHeer will now demonstrate how to properly evaluate for equinus.
To document ankle joint range of motion for ankle joint dorsiflexion with the knee extended and knee flexed, and also ankle total range of motion and plantar flexion and dorsiflexion, you're going to want to use a goniometer. I like to use goniometers that come in 2-degree increments so you get a little more accurate measurement. So the first thing you want to do is you want to take the vertical arm of the goniometer and you want to bisect the fibula. So we're going to do that, and the best way to hold this one in place is to use your thumb and forefinger kind of around the anterior and posterior aspects of the fibula. And then you want the horizontal arm parallel to the weight-bearing surface or the lateral side of the foot. In a cavus foot, because the front part of the foot is lower than the back part and plantar flex relative to the hind foot, you really don't want to worry about your horizontal arm to about the 5th metatarsal base. Don't worry about it going all the way out to the 5th metatarsal head. So we're going to get our vertical and horizontal arms of the goniometer in place. This is the most important thing. You want to maximally supinate the foot. When you maximally supinate the foot, you're limiting mid-tarsal joint range of motion to 2.5 degrees, which is clinically insignificant. So that provides a more reliable measurement as opposed to the standard method of putting the subtalar joint in neutral, locking the mid-tarsal joint and then dorsiflexing, or even worse, pronating the foot and dorsiflexing. So let's get our vertical arm in place. Our horizontal arm, supinate the foot, and then we're going to maximally dorsiflex to end range of motion, and then we're going to come off and measure. And Monica here is about a negative 10 degrees. Sometimes patients want to help you, so Monica, go ahead and try to pull your foot up for me. You can see their anterior tibial tendon engage. If they do that, I'll just tap on it. Go ahead and hold your foot up again. Or I'll just press down on it like this to take it out and then dorsiflex, because I don't want their active help with dorsiflexing. So now we're going to do this same movement with the knee flexed. So go ahead and bend your knee. Again, we're going to maximally supinate. We're going to get our vertical arm in place and hold it onto the fibula and our horizontal arm, and we're going to dorsiflex. We're going to come off, and as you would expect with the knee flex, she's a lot more dorsiflexion. She gets up to about a plus 16 or so. The final thing we need to document is total ankle joint range of motion. So we're just going to dorsiflex maximally and plantar flex maximally. This does not have to be supinated. So you just want to document the total range of motion from about 90 is your starting point. So you're just going to go up and then down. And you want to document those numbers measured with a goniometer.
Some things to remember when documenting an ankle joint contracture. 1. Always position the foot in full supination for a more accurate measurement. In this position, ankle joint contracture is defined as less than -5 degrees of dorsiflexion while the knee is in full extension. Or, put another way, if the patient is plantar flexed 5 degrees or more when the knee is extended, then they have an ankle joint contracture. Number 2. With the foot fully supinated, document your dorsiflexion measurements, knee extended and flexed. 3. Finally, be sure to document the total range of motion to show that it is a non-fixed contracture. Studies show that Aquinas is often associated with many acute pathologies. When performing an initial examination on patients suffering from these pathologies, it is important to check for an underlying Aquinas. If the contracture is present, be sure to diagnose, document, and provide the necessary treatment. The Equinus Brace is dual-coded as L4396 or L4397. We recommend billing L4396 when modifications have been made to customize the device based on the patient's anatomy. When billing any non-Medicare provider, we also recommend billing for the hinges. L2210 times 2 units per brace to account for the medial and lateral hinges. Also, be sure to use your RT-LT modifiers when billing for bilateral braces. For example, when billing one brace to a non-Medicare provider, you will have 2 line items and 3 total codes. On the first line, L4396 or L4397, and on the second line, L2210 times 2 units. For Medicare, you will only bill for L4396 or L4397. Additional billing and documentation guidelines can be found on our website, www.fixaquinas.com.